Good afternoon, everybody. Thank you very much for joining us today. We are going to be going over Mastering MIPS reporting for the 2023 year. This is, getting to halfway through submission season, and we know a lot of people are looking to do uh, their last minute changes and last minute updates to their data. And we thought we'd have the opportunity today to go through that with you. So we're going to get started right away. We believe this will take more or less the whole hour, but we would love for you to ask your questions. And I have the expert on with us today. So welcome, Kelly.
Hello.
Kelly, as most of you on this call have known, has been with Healthmonics for a very long time. I say one of the beginners with the company and founders, let's say, whatever we want to call that. And we're going to be working through a number of slides here, kind of giving you guys what we think is the most important things to know prior to submitting your data. And there seems to be a lot more people that are joining right now, so that's great. Um, and we'll move on. So the first thing I want to cover are a couple of the GoToWebinar information. Now, I know for my side it has changed, so it may look very different on your side as well, so I need to update some of these slides. But for handouts, you'll be able to see the handouts in the GoToWebinar, including the slides that we're going over today. If you cannot find them later this afternoon, once this is over, I will be forwarding the entire recording as well as the entire slide deck presentation. So that will all be available for you. As well as you can see here, there is an opportunity to ask questions on the right-hand side of the screen. You can click on the questions and ask what you would like. If we cannot get to that during the presentation, or if we don't cover it during the presentation, you'll hear from me by the end of the day tomorrow with an answer to your question. So please ask questions. We love answering them here. So a couple of the things that we're going to discuss today, just to review, is navigating the MIPS landscape. So what does it look like today? This is not a call to go over 2024 and what's to expect. We've done that already, and we'll be doing another one, I'm sure, coming up in February and March on 2024. We'll be going over submission. What do you need to do? What do you need in front of you? What does it look like? Because there are a lot of changes in how submission looks in 2024. If you're or 2023, if you're a customer of ours, there are a number of resources available on our help desk platform, um, and with that, you'll be able to uh, uh, utilize that information to help you through the submission process here at Healthmonics. And then as well here, we also have solutions to common challenges. Once again, I do see a hand or two raised for here. If you can just ask the questions, we won't be opening up the microphones for everybody during this presentation. We have a lot to go off of. Thank you. Great. So I'm going to turn it over to Kelly.
Thank you, Mike. All right. So first thing, of course, when we're talking about MIPS is checking your MIPS eligibility. This is all based on your clinician type, practice size, service location. You may have to report, measure, and activity data for your quality, improving activities, and promoting interoperability performance categories. So your measure performance across the MIPS performance categories. They're each going to have a specific weight, and this will result in a MIPS final score from 0 to 100 points. Your MIPS final score will determine whether or not you receive a negative, neutral, or positive MIPS payment adjustment. So for clinicians with a 2023 final score above 75, you can get a positive payment adjustment. For clinicians with a 2023 final score of just 75, you'll get a neutral payment adjustment. Anyone below 75, you're going to get a negative payment adjustment. So it's very important that your payment adjustment is based on your 2023 performance year. Those payment adjustments are applied to your MIPS Medicare Part B covered professional services starting in 2025. So if you're unsure about your eligibility, you need to go to qpp.cms.gov to check your status. And we can go to the next slide. There are a couple participation options. Of course, you could do individual reporting. That's going to just be for an individual MPI for a MIPS eligible clinician. You could do group reporting. That's for an entire TIN of individuals. There's also a virtual group. This can be something that you get together with another group of clinicians. This does have to be CMS approved virtual group that you kind of have to register for as a virtual group. There's also APM entity reporting. So this is, collecting and submitting data as MIPS eligible clinicians that are identified and participating in a MIPS APM. And then there's also subgroups, which this is a new, brand new this year in 2023 option that's only available for clinicians reporting as a part of the MIPS value pathway or MVP. And in order to report as a subgroup, you would have had to register as a subgroup back in the fall. So that's the only way to do that participation option. So a little bit about the performance category weights and reweighing. So specifically for small practice, if you're doing the standard weighing for small practices where the PI is weighted to 0 because small practices are not required to report PI, your quality will be worth 40%, your IA 30%, and your cost 30%. Let's say because of your specialty or just because you do not have any enough eligible instances to actually get scored on cost, you might actually be, not scored on cost. If you're a small practice, you can have 50-50 for quality and IA. If you don't know, let's say you haven't reported the past couple years because of the extreme and uncontrollable circumstances, I would lean towards the first set of reweights. I would assume that you are getting scored on cost. Do not assume that you're getting the 50-50. Now, if you're part of a large practice, your standard weighing is 30 for quality, 25 for PI, 15 for IA, and 30 for cost. Let's say you're PI exempt, you might have asked for a PI exemption before the end of December, or maybe just due to your specialty, you're naturally PI exempt. Those 25 points for PI are going to end up in quality. So the quality is going to be worth 55%, and then 15 and 30. But if again you have, for whatever reason, you do not have enough instances for cost measures and you end up not getting anything for cost, again, all of those points end up in the quality category. So you really have to be doing well in quality because it's 85% quality and 15 in IA. So you really have to have your stuff together in quality if that's the case. So next thing we want to talk about is navigating the MIPS landscape for submission. So it's really important to master MIPS reporting. And one way to do that is reporting as a group and as an individual at the same time. So we do have just a little bit of an example to sort of talk through. Let's say you're a 20 provider group and your MIPS group score is 89, which of course puts you in the positive payment adjustment section. Now, if you were individually reporting, your individual scoring, each provider gets their own score. Let's say some providers would be below 89, some were above 89. And some of these providers are having a hard time meeting that minimum 20 patient for some of their measures. And that's, probably why they're below 89 points. And you also can't take advantage of patients seeing multiple providers and some providers are meeting the measure, some providers are not. You're not getting that benefit from group reporting. Now with group reporting alone, everybody's going to get that score of 89, but some providers get pulled down by lower scoring providers providers not doing the measure, reporting that as they should, um, some providers not pulling their weight in the measure reporting. But if you do both reporting as a group and as an individual, with which of course MIPS Pro allows you to do, the providers that are scoring higher than 89, you can submit their individual scores and they get that higher than 89 score. And the providers that are scoring lower, they're going to get that group score of 89. They're going to benefit from the providers doing well. And they also, the providers that, maybe have a specialty, they're going to get benefit. They're going to hit that 20 patient minimum in the group scoring, and any kind of specialty providers benefit from the other measures that other providers are reporting. So really great way to benefit, get the best of both worlds. Another thing we want to talk about, especially during submission, sometimes this comes up, is EMA reporting, or eligible measures applicability, is what EMA stands for. If you submit fewer than 6 measures or submit 6+ measures but no outcome or high priority measure, CMS will apply what they call a denominator reduction process. And that's going to be to determine if you reported all measures related to a clinical topic within a specialty set. So if CMS determines that you could have reported more measures, you'll receive 0 out of 10 points for each required measure that isn't submitted. So they're going to look at your claims. They're going to see if you should have reported more based on what you submitted. Reporting EMA should always be a last resort. This should not be your go-to. You should always be reporting 6 measures. That should always be the goal. But of course, there are some people who are so specialized, you literally do not have 6 measures to report. So if you are in this situation, you just have to make sure that you're doing it correctly, that you are reporting all of the measures that you possibly can. And you also, to report EMA successfully, you have to report what, we usually call an EMA cluster, but what you'll see called in like QPP documentation, they call it MIPS, clinically related measures grouped by a clinical topic. It really rolls off the tongue. So what you need to do is look for those MIPS, clinically related measures grouped by a clinical topic, and submit all of the measures in those groups to be successful. Even if you don't have any eligible instances in those groupings, you need to submit them all so that CMS can see that you are reporting correctly for EMA. And those clinically related grouped measures are determined by CMS, and they are in their documentation. So that's what you need to make sure that you are doing in order to report EMA successfully. Another big thing to be aware of during submission is your topped out measures. If you are reporting topped out measures, they can be, hurting your performance. So there are 2 types of topped out measures. There's topped out measures that are still worth 10 points, but in order to get the full 10 points, you need to be at 100% performance. And then there's the ones that are capped at 7 points. So the median performance score is 95% or higher, and the performance is so high and unvarying that meaningful distinctions and improvement in performance can no longer be made. So the 10-point measures that need to be 100%, even if you're 99%, usually the 10 points drop to 7 or 5 when you're 99%. So there's no room. You have to be perfect. So you can't have any not mets. Very important for those topped out measures. And the ones that are capped at 7 points often also have to be perfect as well. So you have to be perfect and you're only going to get 7 points for them. So really, really difficult. And also when you have these topped out measures, it's really important to know that, after 3 years of being topped out, these measures may be removed. So these measures are on their last legs. And even for measures that are extremely topped out, the 98th or 100th 100th percentile. Sometimes CMS will remove them even before the fourth year. So these measures are not shouldn't be part of your roster because they are you need backups because they are going to be removed. So very important to be aware of top-down measures. But what's great is that CMS is now actually incentivizing people to report new measures. A first year new measure is guaranteed a minimum of 7 points, whether or not that measure gets a benchmark in during scoring. So that's really fantastic. You're guaranteed 7 points, obviously not as good as 10, but if everybody is reporting a new measure because you're guaranteed 7 points, much more likely to get a benchmark, could be worth up to 10 points. So really fantastic. And in the second year, a guaranteed minimum of 5 points. So really great to look into new measures, do report them. It'll help them get a benchmark, make them worth more, and at least you're guaranteed. So even if it's just an extra measure, I'd really start looking into new measures. And, during submission, you want to look at obviously your performance page and see if there's any way, understand your score, see if there's opportunities to improve before you click that submit button. Use our performance page to really understand. You want to look at your measures, look at the decile, because that is where the score is coming from. It's not the performance rate, it's the decile, the benchmarks. That is how your measure is scored. And if you're seeing where there are opportunities to improve, use our gaps in care page to really drill into the gaps. Look at your not mets. If you're not hitting that 70% completion rate, you're going to look into the incompletes for your measures to improve your score. All right, so we're going to talk about submission a little bit. I'm going to take the first slide and then I'm going to pass it off to Mike. So scoring in MIPS is done very similarly to the way grading was done in all of our school days. So each category gets its own separate grade. So if you kind of remember how, like your quizzes and your tests will be, out of like this percentage, MIPS is scored very similarly. So quality is, weighted 30% of your grade. And then cost is 30%, improvement activities 15%, promoting interoperability 25%. And you can see here we have a nice little summary of how they're doing that grading. So we have quality here, and we can see that 85.8% is the total score within the quality category, but then we have to times it by the weight of that category, the 30%, to get the total points overall. And that's how we get the 25.74%. And very similarly, we do the cost, we got 63%, again, times the 30% category weight. And then I always like to call this MIPS math because it can get very confusing for folks. You kind of have to refer back to the CMS documentation. It's like, okay, wait, how do I do this math? And we're going to go into it for each category for you, break it down. But this is just our little overview, and now we're going to break it down by each one. But again, improvement activities, that's out of like 100 times 15, and then you get, your 15 points. And then for promoting interoperability, very similar, it's 92%. Times 25, and then out of 100. And you can see those get all added together. Complex patient bonus is just straight points that get added on. And that's based on how many complex patients you have, how many patients that have a lot of different diagnoses. And that is a very complex calculation that is that comes purely from CMS. You can kind of look in years past, see what complex patient bonuses you have gotten, to understand what kind of extra points you may or may not get. But those are just straight points added on at the end. So that's our little overview. I'm going to throw it over to Mike to do a couple slides, and then we'll come back to me.
You got it. Thank you very much. I felt like I let you go on for forever there. I gave that was a lot of slides. Um, how the quality category is scored, I'm going to go over this and then I'm going to break it down a little bit on the next page. So for individual group, virtual group participation, quality is going to be 30% of your score, 55% if you're in an APM entity. And for small practices that are not submitting promoting interoperability, it's 40%. So if you take a look at the top, what we have here, and a lot of these slides are directly from CMS, so they are copied off of there so that for accuracy, and you could also go back to CMS and see the same type of results here. But quality performance category score for a large group up at the top is the total measure achievement points divided by the total measure achievement points, available measure achievement points. And that's going to, and then after you do that math, you add the improvement score, and that will be your quality score out of 100. And then for the smaller groups, the only additional part here is that it includes the 6 points for a small practice bonus. So when you have that, it really is a big lift for those small groups. And by small groups, we mean those with 15 or fewer providers or clinicians, sorry. So I want to break it down a little bit more on the next page before I pass it back over to Kelly for a couple of slides here. But these are a couple of examples. I don't need to go into detail with each one of them, but there are a couple of examples of how quality is going to be scored in 2023. So the first one on the top left-hand corner, this is someone that has 6 measures reported. They're getting 8 points per measure, just trying to make it easy math. So they get 48 out of 60 total points. They had the 6 small practice bonus points added, so now they're 54 out of 60. And then they have a 54 over 60 overall equals 90%. With the 1% improvement score, their score will now be 91%. And then that is multiplied by the amount of points for that category based upon your eligibility for each one of the measures. So as you can see, as you move down, I've done a couple of examples here without improvement scores, with large practices, those that maybe have administrative claim measures, or as you can see down on the bottom left-hand corner, this is when there is a measure suppression that's in the system. And when a measure is suppressed, it's taken out of that denominator, and you can see it's out of 50 points instead of 40. So I am going to pass it back over to Kelly to go over the rest of the submission questions.
Sure. So again, with improvement activities, there are very similar. You can see like it's a very similar formula for most of the categories. So, for pretty much everybody, it's 15%. But for small practices not promoting interoperability, it's 30% of their score. And you're going to take the total points earned for the completed activities, and then you're going to divide it by 40 because that's the total possible points earned for improvement activities. And that's how you get the improvement activity performance category score. For promoting interoperability, this page looks complex, but it's just because there's like an example here. So it is 25% of the MIPS score. For APMs, it's 30% of the MIPS score. And obviously small practices, they get that automatically reweighed. So you don't have to, but of course they can if they want to. But you're going to take the total points earned for the completed measures. That's the important phrase there, completed measures, and then divide that by the 100 possible measure points. So you can kind of see here, we have a little screenshot of an example. You can see, some measures, they might be excluded. So that's why it says like completed measures for the total points. and you just divide that out. So this is a very nice example of a breakdown of how you can possibly figure out the points earned for promoting interoperability. And of course, there are some like bonus points available for promoting interoperability to help make up for any measures that you might find lacking. Again, in MIPS Pro, you just fill it out. We do the calculations for you. So make it easy for all this MIPS math. And now for the cost category, again, for most folks, 30% of your MIPS score, APM entities, 0% of their MIPS score. Now, cost performance category, you're going to see it says total achievement points earned for scored measures, and then divided by total available measure achievement points. And you can see that little star there. So total available measure achievement points equals the number of scored measures times 10. Now, the reason that this one's a little complicated is that this is very subjective because some people only get scored on 2 cost measures. Other people might get scored on 5 cost measures. So it really depends. So in the example below, this person only got scored on 1 cost measure. So it's 6.3 out of 10 because they only got scored on 1 cost measure. It really depends on your practice and how many total available measure points are going to be available based on, like, there used to just be 2 cost measures. Now there's a bunch of cost measures. So it really depends on your practice and how many cost measures you might have available to you, what that total denominator is going to be for cost. So it is very variable for cost. And there's no, for quality, it's just 60. That's not the case for cost. It really depends on your practice. So putting it all together, we're kind of going back to that first slide. Again, we're doing, this is just a nice summary of how that you take each category, you put it all together, add it all up to get that final score. You can see here the top one is just a regular, exactly what we had on that first slide. And the second example is for somebody who has promoting interoperability reweighed. So just you could see how it bumps up the points a bit to have promoting interoperability reweighed. All right, and go to the next slide, and I think I'm throwing it back to Mike.
There you go. Thank you. So we're going to talk a little bit now about the cost category because as we're seeing people ready to submit, a lot of questions are coming out around the cost category. If you received your 2022 feedback report and cost was included in some of that, you probably are one of the ones that have reached out and asked, what can I do about costs or how can I deal with costs and how does it impact me? So a little background on costs, 25 total measures. They spanning now most specialties. So a lot of specialties that you believed, prior to COVID time were exempt from cost or didn't have costs associated with them. The big answer here is that you're not exempt from cost. You may not have enough visits to qualify for a measure in cost, therefore it will get reweighted for you. But unless you're looking at COVID exemptions and so forth, or other what they call EUCs, you are not exempt from cost. And if you have the applicable visits, and sorry, not the applicable visits, the applicable um, measure requirements for any one of these, you will get a cost score. So important things to know about costs is it's designed to evaluate the cost to Medicare patients. CMS determines the highest spend category, so that's what the cost measures are. And every year there's been 5+ new cost measures added to the list. Measures are intended to make providers aware of the costs. Measures are adjusted based on the risk of a patient. So patients that are seen as healthy that may have a heart attack will be deemed less risky than those who have many comorbidities and have a heart attack, and therefore scored in this category differently for you. It rewards eligible clinicians for cost effective care. And they're using claims data. So you are not submitting any data through a registry. You're not submitting data through CMS. It is all done based on claims. And not only your claims, it is done based on all claims that fit into the category and that are attributed to you for either that time frame or for that individual measure, and every measure is a little bit different. So the two big measures, I say big, but I don't really mean it in the fact that they count any more than any other measure. So that's really important to understand. The two main measures are TPCC, which is total per capita cost, and that measure may have more attributed patients than any other measure that's out there. But in the end, if you have one of those and you have that measure you're attributed to, and you're attributed to a measure that you have 35 patients for, they count exactly the same for your scores. So this measure focuses on primary care, evaluates the overall cost of care delivered to a patient, and it is done on the per capita costs across all attributed patients and includes all Medicare Part A and B costs for 1 year after the start of that relationship. MSPBC, which is Medicare spending per beneficiary, is the other big one, has a lot more attributed lives to, as well as it's been here since the beginning of the cost program, but it is more in line with some of the other measures that you're looking at. And we're looking here for index admissions and specific DRGs and attribution around that. So it's a smaller time frame, but it is billed based upon something like a surgical procedure during an inpatient stay for MSPB, but other ones are also built around a certain code that has come. So we did a little work on the cost category to see kind of how our 2022 information came about. And you can see, and something I am being very important here, is that these aren't like the other categories where you can shoot for the best score and predict your score throughout the year without the right tools in place. And we do have a tool that I'll talk about later that can help you with that. But what I'm showing you here are the scores for the providers we were able to pull. And you can see here, someone's going to get a 0 and someone's going to get a 30. And everybody else is going to fall in between on each one of these categories and so forth. So what you're seeing is that there's going to be a bell curve for this information. You could start seeing it here, but if you start pulling this information for the entire country, it's all going to even out in a bell curve, and that's because that's how CMS has set this up. So you don't expect to get 15 points or 20 points for a measure, or you're going to put yourself in the trouble. So maximize your other categories throughout the year and don't depend on that cost score. If you have not dove into the data and looked at it and looked at your trends and see how you do without being able to really understand how you can make that impact and beat that minimum score to avoid penalties for 2023 reporting. So we do have a product that's called MIPS Cost Analytics. It shows your estimated cost category score throughout the year, provides actionable insights into each of the cost measures, identifies your anticipated attributed patients and episodes. I think an important thing that's really coming into mind of a lot of even smaller groups now is the sharing of individual patient HCC scores, understanding what those risky patients are, who's being attributed to you, and so forth. It allows for easy identification for down on the provider level, the patient level, of your largest and most impacted patients, providers, locations, and so forth for your cost score. Here's an example of what we're talking about, and this is actually a really neat example because it includes a lot of measures. Some of the groups that we've worked with have had up to 10 different measures or 15 different measures associated with them. So your cost score can be spread out, and it's really about how do you make the largest impact in your work that you're doing. So if you want to talk about how MIPS cost analytics can help you, always feel free to reach out to me or someone on my team. So now I'm going to toss it back over to Kelly as she's going to go through a couple of the common challenges that are in the system for the next couple of slides.
Thanks, Mike. So one of the most common challenges is looking at your data accuracy. So you really need to, I mean, you need to be doing it all year, uh, but you need to really, especially during submission, make sure that the data that you are submitting is accurate. So you want to audit and validate your data. You'll really want to ask yourself these questions about your practice right now. Do all of your clinicians document the same way for data to be captured in an optimal way for MIPS reporting? Is there data that hasn't been captured in the coding that could help your performance? You know, depending on the measures, there could be exclusions, things that take patients out of the population that maybe you're not capturing. Um, and you really want to make sure that that is, something that you can capture. Any kind of modifiers or exclusion codes that aren't built into your MIP strategy, is that something that you can fix? Sometimes it's not something that you can actively fix for your 2023, but you want to make sure that you get that in for 2024. So you really want to focus on that, and see what you can do. The next thing, and of course, really important for this time of year, is timely data submission. You really want to establish a plan. You want to get your data reported and sent to CMS as early as possible during this reporting time. We really recommend getting it in before February 15th. That allows us time to do all of our data submission validations processes. The reason that we recommend February 15th is, occasionally we get pings back from CMS and we like to have time to contact people, have them get back in contact with us, and have time to fix whatever CMS said to us. So having that, kind of 6 week period really gives time for people to fix whatever issue they might have with their submission. Usually no news is good news, right? But if we contact you, uh, you need time to fix whatever issue might arise with your submission. So if that's the case, submitting early is really in your best interest. Scheduling an appointment with HealthMonix. If you need help with submission, you should be able to do it on your own. We have instructions to help do it on your own, but sometimes people like a little help. But there's only so many hours in a week. So you definitely want to schedule time. You want to do that early. And one thing that's very important to know is that you could submit, let's say you hit the submit button today and then you realize, oh my gosh, I totally messed something up. You can reopen your account and you can go in, you can fix that, and you can resubmit. And that submission will overwrite the previous submission. So you absolutely can submit multiple times. The submission deadline from CMS, the deadline from CMS is April 1st this year because March 31st is on a Sunday. So you can submit up until April 1st. We do not recommend waiting that long. So really hold yourself accountable to your established deadlines, get that reporting done and submission done early, because you also really need to start focusing on 2024 as well. It's really hard doing 2 years at once during this first quarter. So the earlier you finish 2023, you can really start focusing on 2024.
Great. Thanks, Kelly. I think I think we may have some time at the end, not a lot to answer a handful of questions. So keep them coming in if you can, and Kelly and I get to them at the end. But I'm going to take you through the last portion of the slide deck as well as offer some advice as well. So Number one, really understand what is this impact. I think something that will surprise people moving forward is that not everybody is going to get a perfect score, and not everybody is going to get a an incentive. I think in years past, if you put a lot of effort into it and if you worked hard, uh, even you could probably not even work that hard for some of the years, and you could get a really, really good score. The longer that this program goes on, the harder that will become. So, really taking a look here, for instance, on our site, you're able to go in and check out with two easy steps what your ROI is looking for MIPS reporting and where it can be. If you reported in 2022 and did very well, they're actually the top performers who got 100 plus or 100 points got 8.25%, and they started seeing that on January 1st of this year. So the scoring is really, available now that hasn't been there in the past. So you could utilize our system here to take a look at that. We do have the availability within our program, and you'll have this in the attachments that you see here, and I'll also include it in the email, is the overview of MIPS reporting in 2023. It's a fact sheet that really condenses all the data into one, and you can use it as a quick reference for any of the offhanded questions prior to reaching out to someone. A lot of your answers could just be right here in front of you. We are very passionate here, if you can tell by Kelly and myself, really want to do the best for our customers and have everything out there to help you succeed in these programs, achieving high quality reporting. We really believe that the work that we're doing when it comes to diving into both quality and cost of your information is really giving us the chance of improving healthcare from our perspective. We're not the doctor sitting in front of you, but we are helping put the things that are in place to help the clinicians really help really work with people. And we feel very passionate here at HealthMonic to do that. And we work tirelessly on updating and upgrading our product to create a rewarding and easy technology to use. So as the year goes on, and what you'll see in 2024 coming soon, our ability to really take a look at maximizing what our customers see on their screens, from being able to report and look and track not only just traditional MIPS, but looking at things like MVPs at the cost category, whether you're joining an ACO or another APM entity, giving you the ability really to dive into your data and understand what your best options are moving forward. Because traditional MIPS is here now, but it is the baseline of what CMS is trying to do with these programs, and we want to make sure that our customers are engaged and aligned with what needs to be done moving forward. So some of the things that we help out with here, our best-in-class US-based support team, integration team is available to reduce the burden of quality reporting, allowing you to do what you do best. I think that's really important. When you call someone here at HealthMonix, you're talking to someone in Malvern, Pennsylvania, who has been here and has worked on these for a long time and worked in these programs, someone like Kelly and the rest of the team here and the success and support team that we have. So we really want to make sure that you are utilizing our system to the best of its abilities, and we offer some of the best people in the industry to help you with that. Ultimate goal, how do you avoid the penalty? I think that's really important to understand. We used to shoot for how do you get the most incentive? Yeah, let's avoid the penalty first and then figure out how to get to the incentive. And we'll work with you. We have the ability here to work with you from all the different categories, as well as dive deeper into your data with you through some of our account management options, as well as some of our abilities to help you with some of the different scoring when it comes to cost, quality, tracking data, digging in and making sure you're reporting on the right measures and so forth. Stay tuned for our next webinar. We should be having a webinar sometime in early February. Most likely it will go over some of the things that you ask about during your post webinar review. So if you have something that you really want to talk about or you want us to talk about next time, please feel free to file that away in the survey so that we understand what is coming next. Feel free to ask me questions. You can reach me at mlewis@healthmonics.com. There's my phone number right there. This is busy season, so bear with us as we get back to you. But we're here to help you with HealthMonics. So thank you very much, and I'll take a look at some questions, see if we could get a couple in before we have to run out of here. Kelly, do you see anything that you want to pop in and talk about while I'm looking?
Somebody was asking about administrative claims and asking if we had time to talk about that. I think it was near the beginning of the
Yeah,
question thread.
here, I'll get it. It is, if time permits, would you talk about the administrative claims measures, what they are, how are they different from regular quality measures, how are they scored? You want to take that, or you want me to talk about it for a minute here?
Um, if you could talk about it.
Sure. No problem at all. So the administrative claims measures are mostly based on hospital and primary care services. There are four of them for 2024. I believe there were only two in 2023. I might be wrong on that number there, but there are four of them for 2024, and they are calculated based solely on the claims for your practice. So there's nothing that you need to turn in. For more information, they definitely have that on the QPP site, the four measures that are tracked, and they just get added to your quality score. You don't have to put any codes in. They're not G code or F code. They are literally done based upon the information that you're sharing as you're billing. So it's not like other quality measures, but it is added as additional measures, a seventh or an eighth measure, or if you're doing MVPs, a fifth measure on top of that. So that is available, and it is in the system on QPP. You can find those, and I'll try to send that to the person who asked later tomorrow.
Okay, great.
Um,
So I'm going through. Let's see.
how do we get started? I love that question. You could just sign up right on our webpage, healthmonics.com or mipspro.com, or you could reach out to our sales department here. Uh, you could call the number that I had on the previous screen. If I could get there, I would share it with you, but I'll make sure you have that in the email later today. You can reach out to me or my team, and we'll be able to get you that back to you. Um, and the prices are on our website for MIPS reporting. See, look, two sales questions. I love it. The cost program, so the cost program, when we get our data, the cost program, we receive the data on a quarterly basis from CMS. The latest pull should be coming in any day now and be able to have that available to our customers. It is delayed based upon CMS, so they need to clear all their claims forms out. So we're anywhere from 4 to 6 months behind on the claims information, but it really provides you with the fastest data that's out there in the market right now for claims that are being attributed to you for MIPS purposes. So it is a bit delayed based upon CMS's timeline, but it still is very useful. I will be sending this out to everybody just to know. I'll be sending this information out, the slide deck as well as the presentation recording, so everybody can have it. I'm going to take the rest of the questions that I see here offline and be able to provide answers to everybody by the end of the day tomorrow. Really appreciate everybody joining. Kelly did once again an outstanding job. I love having you on these. And if there's anything else you guys need, please feel to reach out. We really appreciate your attendance today. Thank you.